There's a lot of noise online about C-section scar massage, belly bands, and ab workouts that promise a flat stomach by 6 weeks. But not all of it is safe. Today, I'll walk you through what's actually helpful for healing your scar and rebuilding your core, and what's pure hype that could slow your recovery or cause damage. Hi, I'm Cherry, a certified maternal and newborn nurse with over 25 years of experience helping moms heal after a C-section birth. If you're home recovering and wondering how to care for your incision, strengthen your core, and feel like yourself again, this video is for you. And before we start, grab my free resource hub below. It includes printable recovery trackers and nurse design checklists to help you follow a structured, safe plan instead of guessing. The link's in the description. A C-section isn't just skin deep. Your doctor goes through 7 layers: your skin, fat, fascia or muscle, and your uterus before reaching your baby. That's why recovery involves both surface healing and deep tissue repair. In the first 2 weeks, collagen is still forming to close those layers. Your job? Protect it. That means keeping the area clean, dry, and pressure-free. When you twist, lift, or strain too soon, you pull on that healing fascia, which can delay recovery or cause long-term tightness. Let's talk about what is helpful. 1. Keeping the incision clean and open to air once your provider says it's safe. 2. Wearing loose, breathable clothing. Cotton or bamboo works best. 3. Using mild soap and water. No alcohol, peroxide, or essential oils. How about what is hype? 1. Expensive scar creams that claim to erase scars overnight. Your incision fades over time as collagen reorganizes. No product can rush that biological process. And 2. Taping or massaging your scar before it's fully closed. Massage is great after your doctor clears you, usually around 6 to 8 weeks. When it's time, gentle massage can help reduce adhesions. Place 2 fingers just above the scar and move the skin in small circular motions. You are helping the tissue glide, not digging deep. If it ever feels hot, painful, or red, stop and call your doctor. Support garments can feel comforting, especially when your core feels weak. But more compression doesn't mean faster healing. Light support can reduce swelling and remind you to move slowly. Tight binding, on the other hand, can restrict breathing, weaken pelvic floor activation, and slow the lymphatic flow. The best band is breathable, flexible, and worn only a few hours at a time. And remember, you should still be able to take a deep breath. If you can't, that is too tight. Now, your core isn't just your abs. It's your diaphragm, deep transverse muscles, and pelvic floor working all together. After surgery, those muscles need restraining, not crunches. Start with diaphragmatic breathing. Place one hand on your belly, inhale slowly through your nose, feel the rise, then exhale through your mouth. That movement gently activates your deep core and supports circulation to your incision. Next, add pelvic tilt breathing. Lie on your back, exhale, and gently flatten your lower back into the bed. No strain, no pain. Avoid planks, sit-ups, or twisting at least 8 to 10 weeks post-surgery and only after medical clearance. Remember, your core is not weak. It's healing from surgery. Here's what most moms forget. Your everyday movement matters more than your workouts. Roll to your side before getting out of bed. That's called the log roll. When you cough or sneeze, hold a small pillow against your incision for counter pressure. If you need to lift your baby, bend your knees and keep your back straight. And when you sit, choose firm back chairs to reduce folding at the scar line. Those tiny adjustments prevent tension on your healing tissue. If you want structure while you recover, grab my free resource hub. It includes recovery checklists, gentle movement reminders, so you can see your progress week by week. You'll find it in the description below. Complete
Free.
Don't wait if you notice persistent redness spreading beyond the incision, drainage with odor, sharp pain or warmth at the site, fever above 100.4 degrees Fahrenheit. Those are warning signs of infection or internal irritation, and early treatment prevents bigger setbacks. At 6 weeks, most moms are cleared to resume light activity. But full tissue remodeling, the point when your scar is strong again, takes about 6 months. Your scar may feel tight, itchy, or slightly numb during that time. That's your nerves regenerating, not failure. Healing isn't linear, and it's not cosmetic. You earned that scar, bringing life safely into the world. Your goal now is comfort, strength, and function. If this information makes recovery feel clearer, grab my free resource hub below. You'll find printable tools that turn healing from guesswork into an organized plan. All free and all nurse-backed. All right, let us recap. Keep your incision clean and dry. Delay massage until cleared. Use light compression only, and rebuild your core through breathing before workouts and protect your scar in daily movements. You don't need fancy tools or viral hacks. You need evidence, patience, and support. For more structured guidance, watch this video next. I'm Cherry, and I will see you in the next one.